All right. Welcome to Dadpuzzles, ladies and gentlemen. It's with a great pleasure that we welcome you to another engaging episode of the Dadpuzzles Podcast. Today we have the distinct honor of hosting Dr. Jasmine Weiss. Weiss is really not only a passionate pediatrician, but also a dedicated diversity, equity, and inclusion researcher, a podcast host, a prolific children's book author, and the driving force behind the revolutionary platform being made. Her unwavering dedication to pioneering innovative solutions and empowering black physicians and trainees is truly awe inspiring. We are absolutely thrilled to have her grace our podcast, and we can't wait to embark on the journey of insights, inspiration, impactful conversations. Please prepare yourself for an enlightening and empowering exchange as we dive deep into the remarkable world of Jasmine. Welcome to the Dad Puzzles podcast, please. Welcome, welcome.
Thank you, Suli. I appreciate you having me on today. It's a pleasure to be here and chat with you on your podcast.
Awesome, awesome. Thank you. Me and you, we have talked, a couple of times in the past, and we have known each other since then, and it's been amazing. I've been really inspired by your journey, and but first, maybe like you can share with folks a little bit about yourself, like where you from, where you are, what's going on.
Yeah, sure. So I'm originally from Charlotte, North Carolina. I was actually born prematurely, so I ended up with a lot of respiratory breathing issues. And that's actually what inspired me to become a pediatrician, to ultimately help other people, just like the
Right.
pediatrician helped me while I was growing up. And
Absolutely.
so I grew up in Charlotte. My family's there, my mother and father. And we'll talk a little bit about my dad here on the Dad Puzzles podcast. But my
Absolutely.
but my
Yes.
family was absolutely instrumental to helping me along the journey, which started for me at FAMU, which is an
Awesome.
HBCU in Florida, and
All right.
progressed from there to medicine and beyond. So
Oh, this is fantastic. I'm always inspired. Because I found people they end up doing something about what their life has given them. So this is a good thing that you're doing this based on your history, and we are really thankful for you doing this. Because other families they're benefiting from your courage and from your inspiration. So thank you so much. Thank you. So I can go on and rambling about you. I noticed that you have, like you have written, like children's book as well, correct?
yes.
Fantastic. So here, at Dad Puzzles, we don't have much content about kids. So I think if we'll be very fortunate to have you back and back again and again to talk about, just everything kids, because we need to know about their health, how we can deal with them. There's so much. So we're just happy to have you today, and we hope this will be a good, like a good initial step to work with you further down the road.
I love that. Yes. I feel like, we'll talk about it, but parents and dads especially are very instrumental in the health and wellness as a whole of all the children that I see. So I'd be
Right.
happy to hop on and share some from time to time.
Awesome. Thank you so much. So, can you tell us a little bit about your journey and what inspired you to really focus on the intersection of the health, education, and upward economic mobility of minority communities?
Yeah, sure. So for me, a lot of this started with my family. I often saw, how the healthcare system treated individuals I knew.
Hmm.
And sometimes they're good stories. Sometimes your family members have bad stories that, of experiences with the healthcare system and how it impacted them. So for me, that intersection of figuring out, how do I ultimately help improve the healthcare system? So,
Right.
when we go to get care, when my grandmother or mother, or when I go to get care, we feel like we're getting the care that we deserve and that
Hmm.
is exceptional, right? So,
Right.
the reason why I feel like it's important to increase representation, especially, is because only 5% of all physicians are Black.
Hmm.
And we know that our communities are really impacted by a variety of disparities. So,
Right.
why not try to increase the numbers of Black and Brown physicians and ultimately help improve those disparities that we see?
Oh, that's really honorable. Thank you. So, your role as an assistant professor, uh, at the School of Medicine there, and you being the CEO of the iDream Enterprise LLC is incredibly impactful. So, can you share a bit, about the goals and the mission that you have so far?
Yeah, sure. So I can start with the research if you'd like, or do you want me to chat a little bit
Absolutely,
about
absolutely.
iDream?
Let's do a little
Okay.
bit of research. Like a dream, whichever way you would like to take it forward, my friend.
Okay, sure. So for me, I told you I went to an HBCU, and I
Right.
recognized there that these are phenomenal institutions that have had such a historical impact and continue to have an impact. And
Right.
so my research is actually centered around how historically Black colleges have contributed to the physician workforce.
Hmm.
And so I've done some kind of interview type research projects that we're hoping to get out soon that share what the students are dealing with as they figure out the journey to medicine. And then we're looking at some big data sets about over the past period of time, what has the numbers look like from HBCUs. And some people would say, well, why does that matter, right? If as long as a physician comes from any institution,
Right.
but what we find is that, or what I expect to find honestly, is that particular schools are really good at helping to make sure they prepare Black physicians, and I want to make sure we highlight those schools.
Right.
And so that is why I've chosen to do this type of medical education research in
Right.
my time as a professor,
Right.
while I see patients as well.
Right.
But you mentioned entrepreneurship
Absolutely.
and me being a CEO.
Yes.
My dad was actually a self-employed roofer, and so I got to watch him as I grew up, watching him go put roofs on.
Right.
He has a picture of me on the roof when I was little that my mom
Okay.
is really mad about.
Right.
But seeing his entrepreneurial drive,
Right.
and among others, I have other uncles and family members who are business owners, and I was
Right.
always inspired by that just as much as I was inspired to become a doctor. And so that's where iDream was born.
Right.
Kind of blending the research focus I have, my interest in workforce, but
Right.
then getting more grassroots and figuring out how do we help younger students who may not see role models in
Right.
medicine, how do we
Absolutely.
help encourage them to move forward in medicine?
Oh, this is fantastic. It's really honorable. We need mentors. We need them. We need you guys big time because you have folks whether like they think they know the system, but it's always good to have a word from somebody that is being ahead of you already. So this is very useful. Thank you so much.
Yeah.
So what in terms of like your project, so far like it has a strong focus on connecting underrepresented students with healthcare professionals from the diverse backgrounds. So how do these connections contribute to shaping, let's say, like a more inclusive healthcare workforce so far?
Yeah, sure. So, one of our initiatives through iDream was our health career boot camps. And so, as a part of those camps, we would invite various Black physicians, and not even just physicians. We had Black pharmacists,
Right.
optometrists,
Right.
just a wide array of careers.
Right.
Because as you mentioned, mentors are good, and for some, they don't have any mentors.
Right.
I get students. I mean, I just spoke to a student a few weeks ago who said nobody at her school ever helped her prepare, and she didn't know any physicians, and she was trying to go to med school.
Right.
And so for us, our camps allow people to not only meet the professionals, but then also go over cases so that they can learn a little bit about, the disease processes and what these individuals do every day when
Okay.
they see patients.
Awesome.
And so it's kind of a twofold. I think on the one hand, we're helping them see what they can be, but we're also helping them by teaching them a little bit about their own health. And so, for example, we talked about how to fill a prescription with our pharmacist. She went
Okay.
through that.
Nice.
So then we can talk about, why it's important for your grandmother to take her medicine every day, right?
Right. Absolutely.
So
Absolutely.
we can blend a little bit of all of that together while also sharing some information about like how the actual process of getting into med school or pharmacy school, etc. So
Fantastic. And you have like a list maybe of people that would like to be mentors so that they can be taking new like mentees down the road. Do you have you that do you have that like established already, or that's something that you're looking forward
yeah,
to
so
having?
that's actually kind of what we're looking for in the future. So you mentioned BMed or Black
Right.
Med Connect.
Absolutely.
So in our new mobile platform that we're building for Black physicians and
Right.
medical trainees, they'll be able to, connect to one another, follow one another, and
Right.
eventually create mentors and mentees through the network that we're building that's launching very soon here.
Fantastic. Fantastic. Yes, we are looking forward to that. We wish you all
Yeah.
the best, and we're looking forward to seeing your product just going all the way, very impactful. We need that. So could you share maybe like a success story so far, or positive outcomes from that have emerged from the iDream like project?
Yeah, sure. So we've been able to have some student interns that were paid. So that was awesome to be able to support some high school and college students
Right.
with internship opportunities, which we need if you're going to go
Right.
on to medicine. And we also have a few students who are actually in the process of applying to med school right now. So we just had our initiatives, recently. So to have some students that we've been able to, support and mentor and provide guidance on their applications, we're looking forward to see how far they can go. So
Okay. Okay.
that's been the impact, and hearing their stories. I
Right.
think when you hear a high school student say, there's nobody in my city that I, have been able to look up to, and you all have helped me, really solidify that medicine is the career I want, that means a lot. So,
Absolutely. Absolutely.
yeah.
Thank you. Thank you. And also, yeah, yeah. I'm one of the victims of not having mentor ahead of me, and I've been going blindly with, like, how when you get good grades in undergrad, you think you got it, and then you go to med school, like you pass your classes, you think, oh yeah, I'm good, but that's really a bad attitude. I think we need to let let the folks know that in the system at the moment they really need that guidance, and most of my colleagues, they have had that, and I've seen the impact that have had on them. So we need to really replicate that to many. So we really value your effort. So far, let's talk a little bit about fathers. Because here is about fathers. I want to really empower fathers so we can be better, and us being better will also, will impact our kids, will impact our wives, everybody in the community, really. So you being this successful, I'm sure your dad has played part, and as you mentioned that he has cultivated some entrepreneurship, some work ethics in you from the young age. So maybe can you talk a little bit about your dad?
Yeah, sure.
Yes.
So, my dad is a wonderful. He's a comedian.
Yes. Yes.
He is very outgoing to some, but then we know him. Obviously, my mom and I, we know the other side of him. So,
Right.
I think the big thing my dad has taught me and has shown me, more importantly,
Right.
is the importance of a dad being present.
Mm-hmm.
Like my dad has just always been there, right? I can remember sometimes he would take me to the doctor because of his flexibility with his roofing
Right.
versus my mom is in technology, so she may not have had the same flexibility just to even go on some visits to my
Right.
doctor's appointment. So especially early on.
Right.
So I just remember, getting to spend time with him. He would take me fishing as a child.
Nice.
He'd be at my, whether it be my concerts, they would both be there, right? My mom and dad
Right.
would be at my concerts, or I
Right.
played basketball. So
Nice.
just his presence, and it really matters when you think about like your security as a person,
Right.
and knowing that you've got people that always are going to have your back no matter what, and a dad especially who,
Right.
if anything goes wrong, he's going to
Right.
step right in for you. So
Right. Right. Absolutely. And so far, I know he's still around, correct? So what's up? What has been like something that is most memorable for you so far with you
ooh,
interacting with him?
most memorable, that's hard. I do think when he taught me how to swim. So my dad was in the Coast Guard.
Okay.
And so before I was born, he was in the Coast Guard before he
Right.
started roofing.
Right.
And so, I remember many times when we would go on vacation, my dad and I would see how far out in the water we can go at the beach before my mom was going to start yelling at the shore that you need to come back, right?
Right.
So
Right. Right.
so I have fond memories of just,
That.
our vacations and he and I being out there because he honestly, right, the Coast Guard protects the shores of the United States. So he
Right.
really loved the ocean. So
Right.
I do too. I think I get a lot of that from him as well.
That's fantastic. Wow, this is like somebody that was talking to me about branding. She had mentioned this is like Trevor. She was one of our guests. She mentioned that it's good to really focus on our branding, and this is your dad brands. Like among the many brands that your dad have. So he used that to really impact his family, and look at you now. This is beautiful.
Yeah.
I love that. So
Yeah.
this is inspiring for dads. Whatever you're good at, make sure you influence your kids as well, because besides the memories that they have of you, I think they will remember like the new career that they have because of you. Imagine that. Like like you're making an impact today in the world because of some part of it that was brought to you by your dad. This is very beautiful and inspiring. So can you like in terms of you being an entrepreneur and academician, so how do you get to balance all that and also seeing patients, like you're a clinician as well? So how do you get to do that, my friend?
Now that's a great question. So
Yes.
it's tough. I'll be honest. I think when you have, I wouldn't say to compete. When you have
Right.
so many interests that are meaningful and impactful to you, you just
Right.
make time.
Right.
And I think that's what I've been able to do so far is balance. When I am focused at work, when I'm focused on patient care, when I'm focused on the follow up related to the patient care, even the days after you see them, that's my
Right.
focus.
Okay.
So it takes a lot of time management skills.
Right.
Like today I've been working on research, right?
Right.
So, very focused for the day on what I'm doing. So this
Right.
evening when I go to start looking at some stuff for my new app that we're building,
Right.
I'll
Nothing
be
else.
I'll be okay. Yeah, I
Right.
won't be worried about the fact that I have this or this to do. I would have already focused on that for the day.
Oh, that's
So
fantastic. Now, do you like arrange them? This is just for curiosity, because a lot of times you start with something that is uh, more intense, and then you go down to less intense, etc. Based on your on all your activities, are you able to say this is more intense, this is less in terms of? I know this is a tricky one, yeah.
that's a tricky one. I think it depends, right? Like
Yes, yeah,
if there's a pressing if there's a pressing patient care need,
right,
then
right,
obviously that's just gonna take priority. If there's a
absolutely,
pressing family,
right,
family concern, that's gonna take priority as well. But
absolutely,
from there, I think deadlines do really
yes,
matter.
right.
So, for instance, if I have a grant deadline, I'm gonna definitely be
Focus
focused and
on that,
and
yes,
and making sure I'm meeting the milestones to reach the deadline in time. So
absolutely,
I will say it's priority driven for sure,
awesome.
as to what has to happen.
Fantastic. Thank you so much. And so far, like your research, it includes the physician workforce diversity and overall diversity of the healthcare force. So how do you envision these aspects evolving, like in the coming years?
Oh, that's a great question. So, the hope is that we continue to increase representation.
Okay. Okay.
The big governing body for med schools is called the Association of American Medical Colleges.
Right.
And recently, in the past few years, we've seen a slight bump or uptick in the number of Black medical students coming
Right.
into the pipeline.
Okay.
So we hope that continues,
Right.
and we hope to figure out. I think starting early is a very big deal, and I think, if for students or medical schools in general, if they wait to just continue to recruit from the same pool of students in college
Right.
without thinking about what it takes to even be interested in medicine, even in elementary or middle school, then
Right.
I think we won't be doing ourselves a service over time. So starting early with, getting kids excited about science and
Right.
learning about the human body and how to think about that as a future opportunity is what I hope we all continue to do.
Oh, that is beautiful. And so as someone that is being deeply invested in the healthcare, what advice do you give for fathers that are striving to instill these values of diversity, equity, and inclusion in their families?
Ooh, that's a good one. So I think I'll talk about that in two different ways. So
Okay.
I think I'll put my pediatrician hat on first.
Right.
I think again for fathers, just knowing that their children are watching, and so being mindful of what you're exposing them to because they're watching, and I have dads bring their patients. Uh-oh. I have dads bring their patients or their children all the time to my practice, and sometimes
Right.
they don't know what's going on with the child.
Right.
So my next set of advice would be to at least, talk to mom or other caregiver about, why you're bringing them to the office. So you
Absolutely.
can have some little notes, or a lot of times I'll have dads just like call the mom and just put them on the phone.
Right. 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 Like they act like very decent, like they have no clue what's going on. Yes.
Exactly,
Thank,
exactly.
thank
So
you. This is good.
I do think that I think that's an important aspect to make sure you know what's going on with your child's health because it's just as important for you to know
Right.
as mom to know.
Absolutely.
Now, when it comes to the diversity piece, I think it's important to help foster relationships with a lot of different people, right? So, it doesn't matter your particular background if there are opportunities for you to get your child involved in, things they like to do and exposing
Right.
them to things they may enjoy.
Right.
That's a way for them to also connect with people from diverse backgrounds too. So, being
Fantastic.
that dad that kind of facilitates those opportunities to try new things.
Oh, that's fantastic. And so, normally, in the past couple episodes, I, I've been sidetracked, and because there was an initial project that I had started in the past where I think if it's good to have the guest ask a question to the next guest.
Uh-huh.
So, you know, the questions that I have, they won't be suitable for you because you're not a dad. However, I would like if you have a question yourself that maybe we can pose to the dads in my next episodes.
Yeah. So to your next dad, I would ask them, what do they hope to see for their child in the future? When their child's an adult, what do they hope to see for their child in the future? And how are they going to help their child get there?
That is fantastic. Makes them think a little bit. They're not just being carried away by the mundanes and not thinking what's going to happen. This is a very good question. Thank you. Thank you. I will pose it to the next person, like for sure. So really, thank you so much for really taking the time today and talk to us. This has been truly amazing, and we thank you for doing this. So how can folks find you, Jasmine?
Yeah, so folks can find me on LinkedIn. I'm just my name, Jasmine Weiss, Weiss, and Jasmine with an E.
Right?
Or you can follow me through Black Med Connect, which is, we're excited about the app launching soon and our
Right?
podcast that we have. So
Right?
on Instagram is Black Med Connect, as well as Facebook, Twitter, and TikTok. So
Fantastic.
yeah, you can find us there.
Awesome. Well, thank you so much for doing this, and please, folks, go ahead and we do have a website, dadpuzzles.com. We have everything there from all the social medias. We encourage you to really subscribe as well. YouTube, focus on that if you forget everything else. And we look forward to having great guests going forward, and we're crossing our fingers that Jasmine will love to come back so we can learn about kids. And please post any questions that you would like to learn about kids so that she can prepare like a little presentation for us, like now and then whenever she has time from a very busy life. Thank you so much, Jasmine, and thank you.
All right. Thank you. Have a great one.
Thank you. I appreciate that.